Hello, Slim and I are here to talk about the use of high energy on the spine to relieve spinal pain. In part one, we discussed the theory of the technique and the circumstance in which this technique might be used. This video is to describe the technique itself in order to tell you what you might experience if you were to undergo this technique yourself. The technique is performed under X-ray guidance, and the patient is laying on the procedure table. If we're working on the sacroiliac joint, which is down here near the bottom, this large joint, there are 4 needles that are typically placed, located here, 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 and here. If we're working on the lumbar spine, which is conveniently colored green in this model, the locations would be just above and just below the joint in question. In this case, this joint would require 2 needles. If we're doing the technique on 2 consecutive joints, then there would be a 3rd needle involved, so it might be 3 needles. Similarly, if we move up to the thoracic spine, which is colored blue, the idea is almost identical in terms of the location of the needles, just below and above the thoracic facet joints. And finally, when we move up to the neck, which is conveniently colored purple, the locations are once again just above and below the specific joints. And again, there might be 2 or 3 or even 4 needles applied at the same time in order to treat 1 or 2 or 3 joints. Once the needles are placed, then there are 2 different kinds of stimulation that are applied. The first is what we call sensory stimulation. That's applied at a high frequency in order to make certain that the location of the needle is likely to disrupt the pain. The second kind of stimulation is what we call motor stimulation. It's a very heavy, slow, low frequency kind of stimulation. It feels like a heavy thumping is the best way to describe it. The purpose is to make certain that the needle is not located too close to one of these large nerves that exits the spine and might go down into an arm or a leg. So we want to just make sure that there's no chance of causing extra nerve damage. Once those 2 types of stimulation are safely and appropriately completed, then I would inject some local anesthetic through each of the needles in order to numb up the location that we're going to apply the energy. After 5 minutes, then the energy is applied through each of the needles. Typically, it's applied for about 90 seconds. The needles are then removed and the procedure is completed. The patient then will go home for a recovery period that is typically 4 or 5 or 6 weeks. One can expect a bit greater than normal discomfort for 2 to 3 weeks after such a procedure, and this may require taking a little extra medication or applying some cool cloths to the area while recovery is proceeding. At follow-up, pain is reevaluated, and then, assuming a successful result, patient is often referred to a physical therapist to learn some strengthening, which may have been lost due to the chronic pain itself. Thank you.